Hello, everyone. Welcome to Hearing Loss Association of America North Bay Chapter, our September 2025 meeting. The mission of our organization is to improve the quality of communication for people with hearing loss through information, education, support, and advocacy. And at today's meeting, we have Tianyu Xue, who's from Yeasound, and you can wave to him. He's going to be presenting today about over-the-counter hearing aids that his company is making. So what we'll do is Tianyu can present and we can ask questions if you don't mind while you're presenting, or you can put them in the chat and we'll ask them afterwards. All right, so welcome, Tianyu. I want you to know that we met with Tianyu and his colleagues, Vanessa and Joy, here in Marin County back in July, and we had a nice get together and talked about our chapter and what we're doing. So we're so happy to welcome him today. So would you like to share your presentation?
Sure, of course. Thank you, Sarah. I'm requested share my screen. Yes.
Okay.
Okay. So, Sarah, I just requested share my screen.
Yes, I did. I clicked it was okay. Yes.
You click it okay. Okay.
Okay.
Okay, cool.
It's there it is.
Yes, there it is. Wait. Okay, you can see my screen, right?
Yes.
Okay. So, thank you, Sarah. Thank you everyone for coming here, for having me here. I'm so appreciate to have a presentation in HLAA. It's my first time. Okay, so today I like to share how is the OTC hearing aid, or how is the hearing aid industry changing from the old world of traditional hearing aids to the new world of OTC hearing aids, and how to select a right hearing aid for you or to your loved ones. Okay, let me start. First, I will start a bit of myself. So in the past 8 years, I working in the healthcare industry. I working across sales, marketing, service, and corporate strategy in leading multinational companies. So I started my job in 2018 in WSA. WS stand for two companies, Vidix and Siventos. So they are all leading hearing aid provider in the world. And they merged in 2019 as WS Audiology. And in 2022, I moved to Cochlear. Cochlear is one of the provider in the world for the cochlear implant system. And in 2023, I just finished my MBA degree in the University College London. So London is a vibrant city. I love London. And after that, 2024, I joined Itilu Luxottica, integrating with hearing care and vision care. And you may heard some brands like Isilu, like Ray-Ban, like Oakley. So they are all brands under this group. And 4 months ago, just in this year, 2025, I joined Yeasound. So Yeasound is also a global company. with leading audio and vision technologies. So we have 6 offices around the world, and our footprint covers over 140 countries. So what drives me, I think, is that I believe the innovation can make hearing care and vision care more accessible, more inclusive, and more effective for everyone. Okay, here is the topic we will cover here. Why the early action matters, the user journey of traditional hearing aids and OTC over-the-counter hearing aids, and also the performance levels for the both, and also how to select OTC hearing aids for yourself. And the last but not least is about my company. Okay, so in this page, we can see why early action matters. So I divided it into 3 parts. On the left part, you can see the different form factors of hearing aid. On the top of it is the BTE, behind the ear, the most powerful and reliable hearing aid. Then is the RIC, receiver in the canal, the most common nowadays. So the major difference of these 2 hearing aids, you can see the BTE is the air tube put in your ear canal, but the RIC is a speaker, a receiver put in your ear canal. Because we put the receiver outside the main body of hearing aids, so the RIC hearing aids are lighter, more comfortable for your feet. So this is why RIC is more common today. And the CIC completely in the ear is very discreet but less functional because it's too small. And the last is next generation design hearing aids or some new design hearing aids. Most of them, they are over-the-counter hearing aids for the mild to moderate hearing loss. So they have more innovation and more affordable price. And in the middle of the screen, you can see the key findings of the value of early intervention of hearing loss. So first, it keeps communication smooth and it supports cognitive health, and also you will have a good quality of life, and also prevent the further damage, and also it save cost over time. The symptoms of hearing loss goes gradually from like muffled sounds to the trouble in noisy places. Yeah. And also there is Juno says there is 1.4 times higher of risk of dementia if you left the hearing loss untreated. And on the right side of the screen, you can see a lot of companies. So on the top of it is the traditional big 5 hearing aid provider. So these companies dominate the premier hearing aids. And in the middle is the 3 key players of cochlear implant system company. And in the bottom of this line, you can see a lot of OTC, over-the-counter hearing aid companies. So these companies are more innovation and have affordable price for everyone. Okay, and in this slide, I will share you a bit about the fitting pathway, the user journey of traditional and over-the-counter hearing aids. So I divided the user journey into 5 phases. The awareness, you have awareness of you have hearing loss, then you do research. What should I do? What is hearing aid? Then you purchase your device, maybe a hearing aid, OTC hearing or traditional hearing aids. Then you do fitting your hearing aids to your hearing loss. Then is after sales service. So in each phase, some of different. For the traditional hearing aid users, so they usually notice they have hearing difficulties, sometimes pointed out by their families or their friends. And then they do a research. They visit the doctors or audiologists or healthcare or the hearing care providers. They receive professional diagnosis, and they have personalized fitting process. So the thing is, they need multiple appointments. They will have customer mode, and they will also have professional fine tuning. And of course, the higher price mostly range from $3,000 to $6,000 for a pair. And in the OTC scenario, you usually recognize the hearing challenges, but you do not seek for immediate medical consultation. And you do self-research online, like from Amazon, from Shopify. Also, you discover the product like from social media, like YouTube, TikTok, Facebook. And also you can discover the product offline, like in the in-store retail stores like CVS, Amazon, Costco. And then you do the self-research, do the self-online testing, and buy these products, maybe online, maybe in the retail stores. And then you do the self-fitting. You fit the hearing aids by yourself with a mobile application and or quick start guide. So everything by yourself, but the price is more affordable, like from $200 to $1,500 maximum, I think. So the key differences between them, I think first is the personalized professional involvement versus self-service. Second, I think is the severe or very complex hearing issue versus mild to moderate hearing loss. And let's talk about the performance tiers of traditional hearing aids and over-the-counter hearing aids. So in traditional hearing aids, they comes into three main levels: the basic level, mid-level, and premier level. So for the basic level, they usually around $1,000 per each. Okay, they would include the waterproof, the Bluetooth streaming, and in the mid-level, usually around $2,000. They cover directional microphone, more effective noise reduction, and also rechargeable batteries. And for the premier level, usually about $3,000 for each, and it covers like more premier feature like tinnitus masking and audiocast. Okay, for the OTC hearing aid, they used to sold in pair. So in the other hand, OTC hearing is sold in a pair. But I think most of OTC hearing aids, they can match the mid-level features. And some of OTC hearing aids can match the premier features, but only at one-third price of traditional hearing aid for each. So it's way more cost effective. So I think if you are mild to moderate hearing loss, the over-the-counter hearing aid is a highly cost-effective option for you. But if you buy the OTC hearing aid, you lack full customization from the hearing health provider. If you have a very complex asthmatic or severe hearing loss, you may still benefit more from the traditional hearing aid. So they are different. So first you need to check your hearing loss. And how to select and right OTC hearing aids for yourself. So here is the benchmark. You just think of it as a step-by-step evaluation. So first is tunability. So that your hearing aids can connect to your phone, and it allows to adjust for your specific hearing audiogram. If no, it's just a sound amplifier. So I suggest you to pass it because it may like somehow harm for your hearing. And then you compare the basic and mid-level functions. So for example, like directional microphone, noise reduction, waterproof, and then you compare the price and brand. So you need to pick a brand with transparent pricing and ongoing update. And good brand always invest on the after-sales service. So talking about after-sales service, so you need to choose a brand with good warranty, with good customer service, and also easy for return. That would make your experience more smoother. And lastly, I think you need to compare the premier function because I think premier function for the over-the-counter hearing aids is nice to have. Because you are just people with mild to moderate hearing loss. So a premier function just nice to have if the money makes sense. And lastly, I would introduce you about my company. So Yeasound is a global company. So we are on the top of audio and visual technology in the world. So our footprint covers 140 countries. We have, so far, we have 4 business units. We have desk phone is the top one in the world. As you can see, the picture 1 and the picture 2, they are all our desk phone. And we also provide a video conference system. You can see the third picture. This is our video conference system. This is what I have meeting with you. You can see the camera is very intelligent, can capture my face. Yeah, everything looks so nice. And our partner in United States have a lot of big companies like AT&T, Verizon, Coca-Cola, Adidas. So they are all our partners in America. And we also have the business headset. You can see the fourth picture. So leveraging all these expertise, and we use our very technology laboratories. You can see the top, you can see the bottom of the screen. These are our anechoic laboratory and reverberation laboratory and EMC laboratory. So leveraging all these expertise and following the FDA regulation of OTC hearing aids in 2022, we just launched our hearing aids division. So our mission is empower everyone to hear the world without limits. And I believe, as what I said at the start, I think pioneering innovation makes hearing accessible to all. So to close this presentation, so I just leave one key message. Don't wait. The early action matters. So in nowadays, the technology and the innovation can make the hearing health more accessible. So don't wait, just take action. And here is my contact information. If you want to know more about our company's product, you just search eSound on Amazon or visit our official website. Yes, thank you, Sarah. You just mute your microphone. You can turn on it.
Okay. Thank you so much, Tianyu. Can you stop sharing, please?
Oh, sure.
Okay. So there's a lot.
Yes.
Okay. So let's either use the chat to put in questions or raise your hand, get Tianyu's attention or my attention for your questions. I'd like to know, you mentioned partners and you mentioned Coca-Cola and Adidas. How are they partners? I mean, Coca-Cola is beverages and Adidas is shoes. Are they giving their employees hearing aids?
No, I mean, our company have multiple business units. So the first business unit is the desk phone. And also we have the video conference system like this. This is a video conference system for business. We also have the headset phone, the business headset phone. So these three business units, we have partnership with like Microsoft, the Zoom, Adidas, and AT&T Verizon. Yes.
Okay, but I still don't understand. How is the partnership? I don't get it. Can you explain it some more?
Our partnership, like these companies, they need like remote meeting. You understand remote meeting?
Yes.
So they use our video conference system. So they are the partnership with us. We are a provider for them and we update these devices for them. We are long-term partnership. So we also have partnership with Zoom, with Microsoft, because they are the software provider. We are the hardware provider. So we blend all the technology together. So we are a strategic partnership with them.
Okay. Thank you for explaining that.
Yeah. So the hearing aid division is our fourth business unit. We just launched in 2022 following the FDA regulation. But our previously business unit, we have like 24 years history in the world. So we onboarding American like in 2000.
Okay, I
Yeah.
see. All right. So, yes, other questions? Oh, John?
Yes. Can you hear me?
Yes.
Yes,
Oh.
yes.
I'm listening to this because a friend of mine said his wife was having problems, and I suggested to him that the over-the-counter might be a way to start finding out what hearing aids can do for you at a price of $200 to $300 or maybe a little more, as opposed to starting off later and spending $3,000 to $6,000 on your first step and find out you should have started earlier. So is this a good way of starting out?
Oh, so as I said, the over-the-counter hearing aids fits for the mild to moderate hearing loss. So I think your friend need to first check the hearing. You need to check the hearing. So if the hearing loss is severe or she or he have the complex hearing issues, I think over-the-counter hearing aid may not match him. But if like in the day she looks good or he looks good, like just some of sound he can't recognize or just turn on the volume of TV. Maybe she just mild to moderate hearing loss. So I think first he can get OTC hearing aid. And maybe 10 years later or 20 years later, his hearing loss go profound. He can upgrade to the prescription hearing aids. That's more cost saving for him.
Okay, that's the answer that I thought was reasonable. I know that when I first needed it, I was in denial as to there was any real problem with my hearing. And at that stage, you sort of get away with it. But if it had been $20 to, that's a nice dinner. You can, a very nice dinner.
Yeah.
But it offers a way of starting to see if this hearing aid thing would have done me any good. I would have bought it much earlier. And that's what I was recommending to my friend.
Yeah. So this is my topic of my presentation, the early action matters, because if you when your hearing loss go profound, you need to pay more on your hearing health.
Thank you.
Okay,
Pleasure.
all right.
Hi there, I am Tana. I'm actually vice president of this chapter with Sarah. I was born deaf, so I'm not one of your targeted people. I wear high power hearing aids all my life. I mostly wanted to listen to what you had to offer because, I like Sarah, me, a lot of people who have hearing loss and work in the organization. I was also perplexed by the same question that Sarah had about your partnership. And I don't know if it's my hearing, but it seems that what you're doing with Coca-Cola and Adidas is more like they're your customers. You're providing services to them, the remote services, but they're not in partnership for the over-the-counter hearing aids. They're not like in development or research or providing them to employees. Am I understanding that correctly?
Yes, you totally understand what I say. So our company have 4 business. We have previous we have 3 business units. We have partnership with them. But the OTC division we just founded in 2022. Yeah.
Okay. So what would you want people here to know? What would you like our takeaway to be if we're talking about your company to people with hearing loss that we know?
So I like to say we have a strong audio technology base.
Okay.
So leveraging these expertise, we launch our OTC hearing aid division. So I think people can totally trust our technology, and because we have a lot of partnership in America, we can provide very good after sales service.
So you will be launching your OTC hearing aids retail in the States, or you already have?
Yeah, we already have a store on Amazon, and we have some partnership with audiologists, but so far not many, just in some of state.
Okay, that's good. Thank you. Because
Thank
I don't
you.
hear so well, I just want to make sure I understood everything. Thank you.
Pleasure.
Tianyu, do you sell the hearing aids in China?
Yeah, our hearing aids are listed in China from online to offline. Yeah.
And are they available through the health system for free, maybe? Or is it something, where do people buy them?
So people can buy it by themselves, or they can ask for a donation from the government. But the government, they usually have some programs, so they cooperate with companies. They need a bidding, they need tendering, then they select a hearing aid to do the donation. So in China, the insurance do not cover the hearing aids. So people, if they need to buy the hearing aids, they need use their own money, or they can ask for support from the government. But I think the number is not very large. Most of people just buy hearing aid by themselves. I think Sarah, the signal is cutting, right? I think the signal of Sarah is cutting.
Oh, it's okay. I was reading the captions.
Okay, cool.
I'm reading the captions. what countries are you who is the biggest client?
Definitely the United States, because only the United States have the OTC hearing aid regulation.
Okay. I see. All right. So our organization, Hearing Loss Association of America, has some questions they tell us to ask about over-the-counter hearing aids.
Yes.
So I want to ask you those questions. Is there a free trial period or money back return policy with your hearing aids?
Yes, we have 45 days. 45 days for free trial. If you don't like it, you just return to the Amazon or to our warehouse in America. Then we return the money to your credit card.
Yeah. Trying to connect again. Do you need a smartphone app or computer to install it or operate it or customize it? How does that work?
Oh yeah, as I said, the major difference of traditional hearing aids and OTC hearing aids is the customization. For the traditional hearing aids, the audiologist will do the fine tuning for you. You can have personalized fitting process, but for the OTC hearing aids, most of OTC hearing aids, they just connect with your phone. So you help yourself, you do self-service to fitting your hearing audiogram. So our product is OTC hearing aids. So we have a mobile phone application. So when you buy our OTC hearing aid, you just download the mobile application and insert your information, insert your audiogram, and then do the fitting, the fine tuning. Then that's done. That's okay because you just moderate to mild hearing loss. That can meet your need.
Okay. And I think you answered this question. Is the hearing aid compatible with cell phones and smartphones?
Yeah, definitely.
Okay.
The Bluetooth streaming can fit with all the smartphones.
And does it have connectivity with Bluetooth or telecoil? What about the telecoil connection?
Nowadays, I think we don't use telecoil, we use Oralcast. I think it's like the same level technology, but Oralcast are more popular nowadays.
Okay, so they are Auracast ready?
Yes, ready.
Okay,
Our new released product is RIC 800.
okay. Can you adjust the amplification?
Yes, of course.
What else can you adjust on the hearing aids?
Oh, we have tinnitus masking. If you have tinnitus troubles, you can use this function. We also have 4 environments you can change, like in the noisy environments, in the peaceful environments, or in the multiple people talking environment, and in the blue streaming environment, and switch in this different scenario, in this different environments.
All right. Are the hearing aids water and sweat resistant?
Yes, yes. Our hearing aids are waterproof. So when we have in the exhibition in the AAA in America, we have a water box. So we put our hearing aid in that water box for 2 days, and we take it out, it still can work.
Oh, that's good. That
Yeah.
means we can put it in the washing machine. Okay, maybe. How does it control or reduce or block out background or wind noise?
Oh, so we have a premier or effective noise reduction data our engineer put into the hearing aids. And blend with AI technology, it can recognize the environment and do the right things for the noise reduction. Yeah, it's totally intelligent and smart.
Okay. How long is the battery life and can it be recharged?
Yes, it's a rechargeable hearing aid, and the battery knowledge is our company's leading technology. So our battery life is very long. For the single hearing aids, with the full charging, you can use 31 hours. 31 hours. And the hearing aids charger, the box, can be a charger for charge for 8 times, 7 to 8 times.
So, wait a minute. So the hearing aids keep a charge for 31 hours.
No. When the hearing aid is fully charged, it can use up for 31 hours. For the charging time, only 4 hours.
Oh, I see. Okay. So it takes 4 hours to charge it, and that charge is for 31 hours. Okay, now I get it. All right, that seems like a long time.
Yeah.
What is your customer service like?
Our customer service, so we have a remote customer service in both Philippines, in both China. So that's 24 hours. But you can send our email or raise a ticket on the mobile phone application. We will just handle it immediately.
Okay. So does it also have for customer service a text chat?
You mean the text service?
Yeah.
By message? I think currently no. We just have email or telephone service.
Oh, I see. You have email or
Per telephone.
okay. I see. Okay.
Alan, I see Alan raised his hand.
Yes, Sarah, I'm on their website and
Oh,
there is
okay.
a, yes. Okay, I'm on their website and there is a chat bot on there. So there is a chat bot on their website.
Oh, I see. Okay. Oh, that's what I mean. There's a chat bot. Okay. Good. Tana,
I have two questions. One is the warranty. How long is the warranty? And sort of related is how long is the anticipated life of the product?
Okay, so let me answer your question. For the warranty time, we have 1 year warranty time, but you can pay $80 for extra 2 years. So $80 for totally in 3 years. If no, we just 1 year warranty time. And for the OTC hearing aids, I think the business model is quite different from the traditional hearing aids. For the traditional hearing aids, you have a healthcare provider to customize with you, and the price is very high. So you expect a long lifetime of the product. And in OTC hearing aids, I should say our product also have a very long life, the product life. But we encourage you to upgrade your device like every 3 or 4 years, because the price of OTC hearing aid is quite affordable, and we always put the leading technology in the product, so you can enjoy the leading technology of the product. Not like traditional hearing aids, you just need a very clear sound or something. But in OTC hearing aids, you can enjoy other more technologies. So we encourage you can change it 3 to 5 years, every 3 to 5 years. But if you don't want to change, it's okay. The product lifetime is very long.
I have a related question about the rechargeable battery.
Okay.
How long do you think it lasts, and is it something that the consumer can replace themselves, or do they have to replace the whole unit when the rechargeable battery dies?
So the official lifetime of our product is 7 years.
Okay,
Yes.
that's wearing it around like all the time. 7 years,
Yes.
considering full day long wear. Okay.
Yes. So we do the test in our laboratory, and the test time is 7 years. We accelerated the use.
So if
Like all day, very heavy use, and we have consecutive testing for like 1 month, 2 months, 3 months, and we just use our program to calculate. Like 7 years, I think is the maximal the product lifetime. And also for the battery, the battery will decline, so we suggest like every 5 years you need to upgrade the product.
so you have to upgrade the product because the battery is
Yeah.
internal. Yeah.
Yeah.
Okay, thank you. Appreciate it.
My pleasure.
You may have mentioned this. I want to ask you, are you selling your product now in the United States?
So you can check our Amazon store. The Rig 800 will be released in 2 weeks, but we already have another product on Amazon, which is Rig 700.
Okay, so I'm waiting to see that captioning. So I didn't understand that. I'm waiting to see that captioning. I asked if I'm asking you where it's available now in the United States. Didn't hear that.
On Amazon and our official website.
Okay. And let's see, so those are for your customer service. Do you have audiologists as part of your team?
Yes, we have a lot of audiologists in our team. So our company have 3,000 employees, and 1,500 they are engineering. And also we have like 10 or 12 audiologists in our company. in the laboratory or in the customer service.
Okay. Well, that's a lot of people.
Yes.
Mm-hmm. And where are the hearing aids made? What city are they made in?
We made it in Malaysia or China. We have 2 manufacturing sites.
Oh, so you're also making them in Malaysia.
Yeah.
I see. That's interesting.
Oh, I'm not in the OTC market, but I am curious. I know there are some products out there, not a lot, but there are some. What does your product have that the competitors don't?
You mean some features we don't have?
Yeah, why would someone be drawn to your product over someone else's? Is there features that you have or?
For the features, I think we have most of the features, and I can say the RIG 800 is the premier product, the highest level. So we almost have all the features. We also have like tinnitus masking, oral cast. So these features are very premier. So I think most OTC hearing aids, they don't have these features, but we have.
That's true,
So
thank you.
Okay. And what has been the reaction so far to the hearing aid?
So we have a rate of 4.3 Amazon. I think that rate is fair, it's okay. So people have a lot of active feedback for us. So our product, I think is nice. It's nice to have.
Okay.
So am I understanding that you've been selling this product in other countries besides the United States?
We also selling our products in Japan and China.
And so how many have you sold? What's your sales volume?
So totally our division launched in 2022, and we do like 2 years of research and development. So we just released our product in the end of 2024. So we just sold our product like 7 months, but we already sold around like 1,500 units of our products.
Okay,
Yeah.
that's good to know. Yeah.
All right. Are there any more questions that you have for our presenter today? Sandra or John or Jim? And okay. Well, this has been very interesting, Tianyu. We're so happy you could join us and inform us about over-the-counter hearing aids and what your company is doing. It sounds like you have plans to really widen your market, and you answered a lot of our questions about what over-the-counter hearing aids should be doing. So we want to thank you for being here, and maybe do you have any questions for us?
Oh, yes, I have quite a lot of questions for HLAA. So in the North Bay chapter, as I just met you last time, do you have some like offline activities you have? that we can attend maybe someday, because I visit America like every quarter for a month, so I need to arrange my trip ahead of time. So if you have like some offline activities that I can attend, you can let me know. Maybe I can come.
I'm not where Sarah went, but I would suggest that you look at the annual conferences that HLAA National has. They often have a floor with all kinds of products. And also there's other organizations like the Say What Club, and this may not work for you, but there's Association of Late Deafened Adults. But the National Conference for Hearing Loss Association of America definitely has a floor where you can bring your products, and people who will be really interested in knowing more about them. They tend to happen in June, so it'll give you some time to plan for that. I don't know, if you look up HLAA National, there should be conference exhibitor information. Yeah.
Okay.
That's a
Yeah.
good idea, Donna, because next year we'll be in Louisville, Kentucky.
I know. So Louisville is your annual meeting for HLA, like every June or July, I think.
No, the national convention changes places every year. We were in Indianapolis, Indiana. Next year, 2026, we'll be in Louisville, Kentucky. So
Oh,
yes,
cool.
yeah, you could be an exhibitor there. Yes, you do have to pay, but then you're seen by a lot of people and you can talk to a lot of people and they will ask, lots of questions. They want to see the product. Tana also mentioned other organizations. There's one, the NALDA, National Association of Late Deafened Adults. And I can put it in the chat. In October,
Okay.
they're meeting in Colorado, I believe.
Okay. Cool, cool.
NALDA, National Association of Late Deafened Adults. Okay.
Just by the name, because it says late deafened, there are people who come to hearing loss later in their life. Some of them have large hearing losses, but they also move around a lot of other people who have hearing losses and organizations and things like that. So it's always good to get in any kind of national hearing loss convention, is my mind, if you have a new product.
Okay. Thank you for your message.
Also, you can attend HLAA webinars to meet other people and to learn whatever people are talking about. And that, I think, a good way is to go to the website hearingloss.org. That's our national website, and donate any amount. You can donate $1 and get on their mailing list. And then when they have a webinar, like next week, they're having a webinar about hospital safety.
Okay.
Yeah, so for example, some hospitals give every patient that comes in some kind of assistive listening device. I mean, that sort of thing.
Makes
So there's
sense.
a broad range. If you go to those webinars, or you can even go to chapter meetings that are online, and you're on our email list from our chapter. If I post a webinar there, you can go to it. Everything's free.
Oh, cool, cool, cool. Thank you for your message. Yeah, it's quite useful.
Yeah, and we're part of this because it's
Just don't
fun.
show.
You know,
Yeah,
we like meeting people and we
yeah,
like sharing our experiences, and we have support groups where we do that, where we share our successes and challenges of living with hearing loss. Do they have those kind of groups where you live?
okay, cool. So can you send me all these message later by email? It's quite useful. I will follow your instructions to do that.
Okay. So, all right. So, Tianyu, thank you for being here. And now you're welcome to stay. I'm just going to make some announcements, or if you want to leave, that's fine too. But I have some announcements about next week's activities. And we want to thank you for being here. And we know it's a big time difference between here and where you are. So we appreciate your presenting.